Okay. Okay, I want to thank everybody for joining us again. I think it's the third time that we're having a training for our ambassadors, our second refresher. So thank you for continuing to do this work with us in terms of COVID and being here tonight so that you can continue that work. Like I said before, this meeting is being recorded for those that can't join right now. And this is a paid hour of your time, whether we take a full hour or if we take a little bit less. It is mandatory that folks review this training or the video to continue working as an ambassador. So make sure that you are written down as being in attendance with your vaccine team lead. And while you're not speaking in the meeting, because there will be time for questions in between the conversation here that I'll be asking Dr. Kantola, please make sure that you're muted just so we get less background noise. But first, I'll just give Dr. Kantola the floor for a second to introduce herself, say a little bit more about where she's coming from. So Dr. Kantola.
Hello, everybody. I'm Kantola. I'm a family medicine physician. I practice at Oaklawn Medical Group. My office is in Olivet, Michigan. And I see folks from ages 0 to 105. So is my oldest patient right now. So it's very nice to be here. And I hope we all get a lot of good education out of this meeting.
Thank you so much, Dr. Kantola. And to get started, this training is going to be formatted in a little bit of an interview version. So I'll be asking Dr. Kantola some questions in different sections, and then we'll pause after every section for some feedback from you all, questions, clarifying all of that kind of stuff. So the first thing we wanted to cover for you all is a little bit more about the bivalent vaccine and booster doses, which have been more of a hot topic this past year. So Dr. Kantola, the first thing I want to ask is, what is the bivalent booster and who is eligible to get it?
So the bivalent booster is actually an updated vaccine that has been formulated to protect against both the original COVID-19 virus and the two most dominant Omicron variants, the BA4 and the BA5. Early this fall, Pfizer and Moderna both developed a bivalent booster. They were first available to people 12 and up in September, and then were expanded to the 5 to 11-year-old age group in October. And most recently in December, Moderna has approved their bivalent booster to children ages 6 months to 4 years old. So you are able to receive a booster dose, everyone age 5 and up, if it has been at least 2 months since your last COVID vaccine dose.
Awesome. Can you tell us why we need to get booster doses if we've been fully vaccinated with that initial series?
Yeah, absolutely. So this COVID-19 virus, as you know, has been very good at evading our immune systems. The high transmissibility of the virus just in general puts it at high risk of mutation. And so it's actually right now, the current variant Omicron does not resemble much of the original COVID-19 variant. So that original booster or the original primary series that we had does not provide much or complete protection against that.
Okay. And with that in mind, can folks still get COVID even if they have the updated booster in the initial series?
Oh, absolutely. Right now, everyone knows that. And, you know, the main goal actually at this point in time is to mitigate the hospitalizations, the severe symptoms and death from COVID-19. Completely eliminating an infection is a very difficult thing to do, and that is no longer the primary goal of the vaccines.
Awesome, thank you. And do you know how many booster shots that folks will need to get in the future to stay protected? Because that has changed over time, especially in the past year with the new bivalent.
Yeah, absolutely. And that's a question that I don't think we know the exact answer for. Is this vaccine going to be something like the flu vaccine that we have to have updated every year according to the DNA sequence of the virus, which mutates? There's a lot of research in play. Right now, they're actually developing nasal vaccines was actually like induce more of a mucosal immunity in the upper respiratory system, which have found to have longer lasting immunity. So, I mean, the short answer is I hope not, but it is entirely possible.
Okay. And is it normal to have to get so many booster doses of a vaccine to keep that protection?
I'm not sure if it's normal. I don't know what is normal anymore, but certainly we know, the influenza virus, we don't think of those as boosters, but in essence, they're priming our immune system. Our hepatitis, that's a 3-dose series. After that, it's, we are thought to be completely immune. Hepatitis B, viruses are vastly different, just according to, how they work. And we do get boosted against other things like, our DTaP shots, we get every 10-year boosters. So we're not used to this idea of so many boosters in such a short period of time. And so I wouldn't say it's normal, but I would say it's something that it's expected with the current pandemic and the SARS-CoV-2 variants.
Thank you. And I know you mentioned a little bit earlier when we were talking about eligibility that there's several different brands of the new bivalent booster. Should folks get a different brand of vaccine for that booster? Say they got Pfizer initially, should they get Moderna, or should they stick with the same brand as their original series?
So adults, well, anyone actually 5 and over, if your primary series has been Pfizer or Moderna, you can get either bivalent booster. You can. Now, it's a little different for kids under the age of 4. That is Moderna only. So Moderna only has a booster for that age group. So I mean, in short, for adults, it does not matter.
Awesome.
I specify though Moderna and Pfizer, not the other 2 that are out.
Absolutely. Thank you for the clarification. And what symptoms can folks expect from the bivalent booster?
So, just as any other vaccine, you are priming your immune system. You're getting an immune response. So the most typically reported symptoms include fever, tiredness, chills and joint pain, pain at injection site. For children, it's reported they might be a little more irritable. These symptoms are typically very minor and last less than 2 days.
Awesome. And when should folks seek medical attention for any symptoms or reactions that they're having to the booster?
So 2 days, any symptoms lasting longer than 2 days, your doctor should be notified. Patients are, just very short-term severe anaphylactic reactions. Those occur within 15 minutes, and that's the rationale behind waiting that 15 minutes after administration. But after that 15 time frame, anything that is severe lasting 2 days, if you have pain or increasing redness, like infectious symptoms at the injection site, those should also, those will also require you to call your doctor.
Okay, great. That was the last question we had prepared on the bivalent and other booster doses, but I want to open the floor and give some space if folks have additional questions about the bivalent or those boosters.
Sure.
Hi, yes, I have a question. How are you?
I'm good.
Good. My name is Marquetta Frost from Albion. And most of the questions we're getting, and you may have said it, but we just want to be clear that, okay, you have your first dose and you have your second, and then the booster. So are people most likely getting their first and second booster, then a bivalent, or if you get the first 2 in the series and the bivalent, are you done? So you can actually get the first 2 in the series, then the bivalent, and no more shots at all? Or do you get your boosters and then the bivalent and you're done?
That's a really good question. I think I've gotten that question myself a time or two. So the first 2 doses in the vaccine series are from our primary doses. And so those are the very same vaccines we had. Now, many folks in between those first 2 primary doses and booster and the updated booster have gotten several other boosters, right? I mean, we've been telling them to get them, I think there's been 2 or 3. So at this time, if 2 months has passed between their last COVID vaccine, no matter what it was, a booster or a primary series, they will get the updated bivalent booster.
And
Now,
then they don't need any more boosters.
nope, after you've got, well, it's only been out since October, well, September, October. So as of right now, this bivalent booster is the last one we need, but we don't know how long that recommendation will last. We might need another updated one in 6 months.
So if you've had your 2 primary and then you've had the other before this came out, you still need this shot too?
I'm sorry, can you repeat that question? You cut out a little bit.
Okay, so if you've already had your 2 primary in the series and then you had the other booster, now is this something new on top of that? Okay, so
Yep. This is an updated bivalent booster. It has only been out since September.
okay,
So all vaccines that are administered now should be bivalent boosters.
okay. So we've already had the 3, this is necessary too.
It is, yep. Now, if you are starting over, so say someone hasn't been vaccinated at all yet and they decide they want to, they will still start with those 2 primary shots. And so it would be different. It'd be the only time they would get something other than a bivalent.
Okay. So if they are new and they are getting the 2 primary, if they got, I think she addressed this a few minutes ago, this new one here, do they have to have the 3rd one too, or would that be enough?
Nope, the bivalent booster should in essence be the 3rd dose, or should be the 3rd actual injection. So no other boosters are actually, other than those first 2 shots that you got.
Yes.
This is the only booster now that exists.
Okay, all right, good.
Mhm.
I think that's better for children as well, because if they get this, then that 1 extra shot is it. But yeah, they don't want to be getting 4, 5
Yeah.
shots. That's wonderful.
Children, if you're asked questions about that, I mean, I still get a little confused just because the Pfizer and the Moderna, for some reason, they have different age characteristics. So, I mean, for Pfizer now, if you're 6 months to 4 years, you're still getting a 3-dose series. You're not getting a booster, but that 3rd dose is the updated one. If you're getting Moderna, then you get those first 2 Moderna shots, and then you have to have a Moderna booster. And so those guidelines you might need to, they're a little harder, I think, to remember, but the CDC makes it pretty clear on their website which one that the child is supposed to get.
And the people that administer the shots, they'll know the criteria in which you are. If you're getting the series Moderna, they know you have to have the Moderna booster. Yep. And then they get the bivalent, or?
Yep, absolutely. There's actually no booster for children 6 months to 4 years for Pfizer. Pfizer administers it's called a 3rd dose. And so, that 3rd dose is different than what a booster is. They could have made this a little more straightforward, in my opinion.
They really could have.
Put up, definitely.
Any other questions on the booster, the bivalent vaccine, before we move on?
Can you go back to the age of the child? It was 4 years. Is that 4 years or younger that they can't have it, or?
Yep. So if you are 6, so anyone 6 months and up is actually eligible to be COVID vaccinated. Okay. So if you are 6 months to 4 years old, if you are opting to have a Pfizer vaccine, then you will get 3 doses of a Pfizer vaccine. That 3rd dose will be an updated bivalent dose, but it's not technically a booster. If you are 6 months to 4 years old and you get a Moderna vaccine, then you will get your first 2 Moderna shots, and then that 3rd booster will be the updated bivalent booster.
Okay.
And the real difference between, the children and the adult vaccines and boosters is just in the dose. It's about a quarter of the adult dose.
Okay.
That's some of the information that we don't receive as ambassadors. Those are questions that we get often because they say, oh, I only do Pfizer or I only do Moderna, but we don't know the information you just shared right now. And so that's just very important for us to understand. So I appreciate you saying that, because then we can explain to some that if you only want Pfizer, this is what you get, and Moderna, this is what you get. Because that's something we were not aware of.
Mhm.
And we can make sure that any more materials we have on the bivalent include all the things that Dr. Kantola has said right now. And we'll also include that in the handbook moving forward, so we can get you new copies of that too.
All right.
Yeah. Any other questions about the booster before we move on? Okay. Our next section is a little bit about COVID-19 in general, partially having COVID, and some of the consequences and different portions of what COVID is. So first, I just want to touch on Dr. Kantola. Why are there different variants of COVID? And are the new variants that we're currently seeing any more dangerous than the original virus from 2020?
I would say the original and the Delta variant were certainly the most virulent strain. We've seen some increased transmissibility in the Omicron variant. It is spread more easily. But in terms of its ability to create very severe infection symptoms, death, the current variants are not as virulent. I must say, though, now we're dealing with a population where there have been many vaccinated and many prior infections, so our immunity towards them is better. There is that caveat. But in terms of them being more severe, I wouldn't say that's the case. And I alluded earlier to the fact that because this virus is new and it's so transmissible, that's the nature of how viruses work. They mutate, their DNA sequence to evade the human immune system. And so that's why there's some.
Awesome. Thank you for that information. In addition to that, there's been some change over time from the CDC on recommendations for quarantining and isolation. So should folks still be quarantining themselves or their children if they're exposed to or have COVID?
So there's two different answers to that. So if you are exposed to COVID, and we're talking, if you have a child who has COVID, or you are in very close contact without a mask, there's a lot of information out there that says, no, you don't do anything, especially if you're vaccinated or boosted. But the fact is that, yes, you still should be masking indoors for up to 10 days after a close exposure. The incubation time of COVID, the Omicron variant in particular, is up to 10 days. So on day 6 after your exposure, you should be testing. You should be testing for COVID, and you should continue to wear a mask until day 10 and take precautions. That doesn't mean you have to isolate or stay at home, but you should definitely be wearing a mask indoors and in close contact.
And I know there's a little bit into our next section, but in terms of masking, when folks are wearing their masks indoors, like you've mentioned, what types of masks should they be using?
So it's the mask that will fit you best and that you can keep on your face is the best answer, because the difference between the masks is basically in the system, like how many respiratory particles they allow through. And so say the best, mask, the N95 has the highest filtration system where it filters 95% of micromolecules. You take that mask off even once or lower it down in a room full of people, then it really negates the effectiveness of the mask. So I tell my patients, wear a mask that is comfortable, if there is such a thing, the most comfortable, and that you can keep over your face that fits well. Cloth masks are, the masks that most people have access to, and that's just fine. They do have a lower filtration system, but if you wear one and it fits well over your nose and your mouth, you can keep it on. That does a very good job of preventing large respiratory droplets from passing between you and somebody else.
Thank you. And one of the other topics, at least around having COVID recently, has been about the effects of COVID long term. And a lot of folks are, at least in the public, calling it long COVID. So can you talk about a little bit what that is and who's at risk for that long COVID?
Sure. I'd be happy to talk about long COVID, but I don't know if I answered your question about the quarantine and masking guidelines if you do have a COVID positive test. So let me just go back to that a little bit to make sure that I made myself clear. If you test positive for COVID, there's a 5-day isolation period. That 5-day isolation period is only asymptomatic people. Okay, so I know in schools right now, it's very frustrating. It seems like everyone's being told it's 5 days, and no matter what, everyone's done after 5 days. That is only for asymptomatic infections. And so if you have symptoms, even it's something like, a small fever, a cough, anything, then you really should be adhering to 5 days of isolation, because you are still very transmissible during that 10-day period. If you do have symptoms, 10 days does seem like a lot, especially for kids. So you have the option to test out and make your quarantine slightly shorter if you have 2 negative antigen tests within 48 hours. But I just, I want to make sure folks are letting, people that you talk to that 5 days is asymptomatic. Any questions about that? I know that's something that's, changed quite a bit in the last year.
I don't want to be the one to monopolize, but I've dealt with this a little bit, and so looking at employers with adults, some of them are recommending that people come back after 5 days, regardless of their symptoms. And it is frustrating because, my niece had it, and they were like pushing her to come back to work, but she still had symptoms. And so I told her, I said, you let them know that you're not coming back for those 10 days. I didn't want her to lose her job, but I didn't want her to infect anyone.
Yeah, that was good advice. And I've been seeing the same thing in my clinic. I've had to write, work notes for people who are still feeling poorly after, because a lot of people are asymptomatic, but I would say that's not the majority of people. Most people have some symptoms. And so, 10 days and it's very clear on the CDC website. I think people just get excited about this, shortened isolation period and have misinterpreted it.
Before we open up for any additional questions, I just want to return back to that long COVID question. So that was, so what is long COVID, and who's at risk for any long-term complications from COVID?
All right. So so we have these categories of COVID. So we have the acute COVID infection, which is about a 1, and then post-acute symptoms are between 2 and 3 months after COVID, which we see a very high rate of fatigue, some shortness of breath, cough, continuing cough, and even like some brain fog, like mental, I wouldn't say mental illness by any means, but certainly cognitive side effects. Those are normal post-acute symptoms. Anything lasting over 2 to 3 months is what we would call post-COVID condition or long COVID. And those really are persistent symptoms. And we're seeing those last up to 4 to 9 months in some folks.
Okay. Thank you so much for that information. Are there any questions about COVID in general, beyond masking and testing, since we'll be talking about that next, that folks have right now? Any clarification questions as well? Okay, then we will move right along to a little bit more about masking and testing. So I know you've talked a little bit about when we should be wearing masks right now, especially indoors. Are there any other recommendations that folks have, whether that's your office or the CDC in general, about where folks should be wearing masks at this time?
Okay, so you should be really wearing a mask if you had COVID-19 symptoms or symptoms that just resemble COVID-19, which I know that's a little hard to tease out right now during cold and flu season. But the fact of the matter is we cannot tell if you have COVID, if you have flu, RSV, the common cold. Sometimes, those symptoms are so hard to differentiate without a test. And so we recommend masking indoors when you aren't able to isolate, and certainly around those people who are at risk, elderly people, newborns, people with immune deficiencies. And so if you are exposed, the recommendation from the CDC is indoor masking for.
So I have a question. Adults can get RS, right?
Adults?
Yes.
Yep.
And that is more of a form of, I mean, that's like pneumonia to children, to babies, than like a common cold to us, correct?
Yeah, that was, in past years, RSV was quite mild among adults and we didn't see it much. This year we have seen more RSV in adults and more severe illness. But yes, you are exactly right. RSV is a disease, that virus that typically affects babies and it can be very severe in children under 2 years old.
And it's contagious, correct?
Absolutely.
So RSV, could it be misunderstood as being RSV than COVID?
Yeah, absolutely.
So
Yep, and
go ahead. I'm sorry.
No, you go ahead.
So basically, it is a form of COVID. It's a strain of COVID in some sense.
RSV is the respiratory syncytial virus, and so it's not a strain of COVID, but it is an upper respiratory infection like COVID is, and can cause similar symptoms as COVID. So it can be hard to tell which unless you have.
Okay, one more question.
For people who are working with in the healthcare, tease out what's RSV, COVID. I mean, that's been very difficult to do, and nobody can say for what you have just based on your symptoms. You can guess, a pretty good estimate, but without testing, you can't say for sure.
Okay, so if people, like the community, go to the emergency room because they're showing symptoms of COVID, but in, most places will turn people away as far as COVID is concerned, and they'll tell them to just, go home and, isolate, whatever. But isn't like if it's RSV, shouldn't they allow them to come in so they can test for it?
Yeah, that's a really great point. Because I feel like a lot of people who have had COVID or something similar to COVID may not be getting the care that they deserve and need. And so, you shouldn't be, I don't think anybody should be turned away who has a concern. I think that most doctors' offices will definitely see you and address your symptoms. If you're thought to have COVID, we have pretty strict masking guidelines in our clinical offices. Sometimes we do have you test prior to being seen. In my office, we do car visits a lot. So my patients who have COVID will have somebody drive them and they'll park in the parking lot and I'll go up to their car and do their exam in the car, just to limit the exposure to people who might be in my office or waiting. But your point is very well taken, that if you have respiratory symptoms, if you're afraid to go somewhere or you can't get in anywhere because of COVID, there might be something very serious missed.
Exactly, right. And I'm sorry, I was at work, but where are you? Where do you work?
I practice at Oaklawn Medical Group, and my office is located in Olivet, Michigan.
Oh, okay.
Yeah, thank you for those great questions. That definitely fits in very well with what we've been talking about, and we'll make sure to have that kind of information added to our handbook and any other flyers or things that we have for you all when you're working at clinics or talking to folks. With our other questions that we have here, we may as well move on to a little bit about testing, since it's been brought up a good bit. So Dr. Kantola, when should folks be taking an at-home test, and when should they be taking a PCR lab-based test?
So anybody who has been exposed to COVID recommended to take a test on day 6 after their exposure. And that test can be a at-home antigen rapid test. If you are asymptomatic, it's the at-home tests for asymptomatic people not quite as good at picking up asymptomatic COVID, basically. So they're less sensitive, but still they're the most readily available. Some of the PCR and AAT testing can take up to 48 hours to come back. So the at-home tests, the rapid tests, are certainly still effective and still should be used, especially for the folks at home who are isolating because of exposure.
Awesome. And if someone does test positive for COVID, what type of test do they need to take to return to work or school?
They need an antigen test. So if you're testing, if you've tested, okay, so I should specify, because this is another one of those that has, many branches of possibilities. So if you're exposed to COVID and you test on day 6, that's the recommended test period for day 6. Unless you've had COVID in the last 30 days. If you've had COVID in the last 30 days, then you should, and you're asymptomatic, you should not be testing at all. There's no indication for that. If you've had COVID in the last 30 to 90 days, however, you do need to use an antigen test. So that's the rapid or the point of care testing that you would get at your office. That would pick up a virus at a little higher load, so it would detect more symptomatic infections. And the reason for that is the NNA test, like the lab-based testing, that can detect COVID that you've had in the past 90 days. It doesn't necessarily mean that you are infectious.
Thank you for that information. It helps with clarification for sure. Another question would be, are folks still infectious after they recover from COVID, meaning that they have no symptoms?
So after 10 days seems to be like the biggest time period for transmissibility. So if you are symptomatic, that 10-day period, after that 10-day period, you're very unlikely to transmit the virus. But if you've had severe symptoms and you were in the hospital, that period can last, 20 days. And so in that case, a lot of anybody who is hospitalized with severe infections, they do need to consult with their doctor about their time period for masking and, eating.
I think the last question I have for you is a little bit towards the masking and general ability to get COVID kind of question, because one of the hot topics that's kind of been in media and circulating around the community is this concept of immunity debt, maybe from masking or some of the precautions that have been taken earlier in the pandemic by most folks. So can you tell us a little bit about what that is and if folks should be concerned about it?
Sure. So immunity debt is it's mostly a theoretical concept at this point in time. It's something that we've postulated and that we think in our minds makes sense. If you have been protected or your immune system has not encountered these viruses like flu, RSV, even the common cold in the last 2 years, they won't recognize it as well, and therefore you will create a larger response to that. You'll get sicker when you do encounter it. And that's been a lot of people's rationale for not wanting to mask or wanting to isolate, because we think we need to be exposed to these things so that we mount an immune response. However, very few of us were in a sterile environment the last 2 years, especially if you have kids. Children, if you've ever seen them try to wear a mask, I don't think much is being completely protected there. And so, we were not in a sterile environment. Our immunity has not been unequivocally shown to have decreased. And in actuality, these levels of flu, pneumonia, and things we've seen this year are quite similar to what was considered normal 3 years ago.
Thank you. And that was the last question I had for you, Dr. Kantola. So I'll open back up the floor if folks have clarification questions or things we just haven't touched on yet.
Sure. Well, if nobody has questions, I think maybe the last thing I would like to make sure people are aware of is if you do have COVID symptoms or you have a positive COVID test, and hopefully you have a primary care doctor, reach out to that doctor's office and know. I think that's really, really important because there are a lot of things we can do now to mitigate the severity of your symptoms. Paxlovid, the oral medication for COVID, is very widely available. It has been very effective in reducing symptoms and severity. And your doctor, depending on your medical history, should be monitoring you, and they should be checking in with you if you have severe symptoms, whether it's via telemedicine, or even, a very well protected in-person visit. If you're very sick, they want to keep an eye on you.
On the medication you're talking about, I heard that that's pretty severe as far as the side effects of it. The pharmacist told me. I did get some. I had COVID, and the doctor did give me the medication, but I didn't take it because he was telling me about the side effects, and it seemed like they were just rough. I just worked it out, but like, it was pretty severe.
Yeah. So the side effects of Paxlovid. So as far as what's been also reported is a metallic taste in the mouth. There's been some rebound infections that have been reported. But overall, what it's been shown to do is just reduce the severity of Paxlovid. Everybody has a different side effect profile or a different tolerance to symptoms. But that compared to COVID-19 symptoms, it seems like the Paxlovid side effects were preferable. But again, very individual. And if you're someone who's at low risk from complications, it is reasonable to forego oral medicine. But it's something you should have.
Mm-hmm.
I have a couple of questions. So my first question is, do you believe that the quarantine time should be more than the 5 days?
So if you are asymptomatic, symptoms at all, I think 5 is reasonable. I do. However, that's 5 days masked, and it's masked up until 10 days afterwards. And that's another thing people forget. After that 5 day period, you still should be wearing a mask for the next 5 days. So most people aren't asymptomatic, honestly. I mean, they have something, whether it's the cold, congestion, and that really does warrant a 10-day quarantine.
Okay, 2 more questions now. So, what about children in school? Should that quarantine time be longer? Why? Because of them being in the environment with all those children coming in contact with them, with the teachers. Should that quarantine time be longer? And also, do you believe that if a child tests positive within a classroom with COVID, should the whole class go into quarantine because they have come in contact?
Yeah, that's a good question. It really is. And it's really so controversial because children have overall displayed, more mild symptoms from COVID. But they're pretty good transmitters of this virus. And so, it's very likely that if one kiddo in that class, like, the little ones, one kiddo gets it, and they're all unmasked, then a good amount of them is. And, you know, I don't know. I just think that you have to weigh those risk factors with, you know, the risks of kids being out of the classroom. And
Yeah.
for some kids, you know, going to school and risking a COVID infection that is most likely to be mild is better than not being in school for 2 weeks. And so it's hard. It really is. You know, I hope everybody does what they think's best for their kids, and they're allowed to do that. But I don't know if it's an easy answer. As a doctor, I would say, in terms of peer transmissibility, absolutely. Yeah, quarantine the kids and they won't get COVID. But
Right.
that's not all there is to the story, you know?
Well, my thing is that, you know, the kids are not mandated any longer to wear masks in the school. So whoever they come in contact with outside the school and they have it and they bring it in the school, and, you know, they come in contact with all these kids, all of these children, and then they go home and they take it home to their parents and their grandparents. You know, our main goal, you know, the purpose of us, you know, as far as, you know, us being ambassadors is to spread the word, to educate, to prevent it, to, you know, try to stop this disease. You feel what I'm saying? And when we, you know, my thing is, you know, with kids, you know, that is just a way to bring those numbers back up and not, you know, come out of the problem and into the solution and bring them down.
Yeah, I agree with you 100%. And it is very hard to rationalize, you know, why we would be allowing some of these mandates to be loosened so much. But the other side of the story is, if you as an ambassador can, you know, educate people about vaccinating, you know, being vaccinated reduces your risk of getting the virus, but also passing that virus on. And so if there's one thing that we all do, it's to get vaccinated. I mean, there's just no better way to reduce the spread, because I think you're right. I mean, there's so much we can't control about what other people do.
Yeah, and I agree with that. But what we can do is this, you know, like the school system and other organizations do their part. You know, it's like we all play a part. We have a accountability in making this happen, and in the, you know, whatever profession they're in, you know, it's the best thing, especially educators, and they're our children, you know. And I mean, it was a decision that was made that they no longer have to wear a mask. But where do we come in when it comes to, you know, slowing this down? And, you know, we can't sit here and just get lax on it, because when it hit us hard.
Mm-hmm.
You know, it took a lot of, you know, our loved ones' lives. And we're not, if we cannot sit there and look at, you know, the lesson has been brought before us, you know, the things that have happened with this illness. It's just like alcoholism or a drug addiction. You know what I'm saying? It's there, you know, and if you feed it, it'll continue to grow, you know. And like I said, it's cunning. Then I look at that disease as being, you know, COVID, it's cunning, it's baffled. We're going to sit back, we can't get lax with it, or we're going to be shut down again, you know. And our babies are the most important thing, you know, for real, when it comes, I mean, other lives are too, but our children, you know. And there's a lot of things that I disagree, but one thing about it is that I do promote it. I talk about it. And that's the part that I play. That's the responsibilities that I took on in the, you know, vaccination. You know, and I will have a conversation with people about that.
Yep. Good.
Yeah, I think a lot of things should be changing. Who am I but one voice? But you know, when you say, you know, what you feel and you put it out there, you know, hopefully somebody picks it up and spreads it, and things can change. And it only can change if, you know, you speak about it. You know, it's common sense. You know what I'm
and you're
saying?
an educator voice. That's the most important part about it, is an educated voice.
Right.
And that's not always the case. So, yeah.
But my last question, I promise y'all, I will not hold you out. This is the last question. So, are there long-term effects? Because I've talked to people that have had COVID, and even after they've had it, they have, effects of it, like the coughing and, different things. Are there side effects that come with that, with COVID after it's gone within your immune system,
Yeah, I think so. 6.2% of patients are reporting long COVID symptoms, so symptoms lasting longer than 2 months. And that's primarily what I've seen as a family physician. So I do see people with acute infections, but most likely, most now I'm seeing people come in with, this brain fog or this fatigue or just, cough and shortness of breath when they don't have a history of asthma or COPD. And you're absolutely, yeah, I'm seeing a lot of it. I think it's quite a big disease burden.
Okay, thank you.
You're welcome. Thank you for your questions.
Any other questions for Dr. Kantola? We have about 10 minutes-ish left of our scheduled time. So anything is welcome.
I do have a question. You have provided a great deal of information to these groups. Is there a talking point that's going to be made available similar to the questions that has been provided and the answers that has been provided to this group of people?
Yeah, I can take that one actually. We do have a handbook that will be updated after this training, especially with the information that was provided. Some of it is already in there, so some of the things about masking that just might need to be updated a little bit based on what Dr. Kantola said. But we will be following up in the next couple of weeks once we get that edited and also have this video up for viewing for folks that weren't able to be here tonight. So that will come out to you all through your lead ambassadors.
Thank you. Do you guys have any questions?
In the school system, as far as students wearing a mask, I think with a school that I'm more familiar with, they leave it up to the parents because at Endeavor, some of the children wear a mask faithfully every day. That's because their parents insist on that, but it's very few. But the majority of the students, they don't wear masks, and most of the teachers don't wear masks. So they leave it up to the teachers and the parents as far as wearing a mask every day.
Well,
I'm
sorry, go ahead.
I would just make sure that, they're aware, they're following the CDC guidelines that if somebody does have a positive COVID infection, they should be masking for 10 days. Even if they're asymptomatic after the 5-day quarantine period's over, that 5 days should be in a mask, as well as close contact. So kids with a parent at home with COVID, they should be masking for 10 days.
Well, I know that there are a lot of teachers are not wearing them, and who would be around to police that, even though that is the guideline?
They're vaccinated, and they don't have an exposure or a positive test, then there is no guideline they have to mask. But you're right, if they were exposed or, there isn't, and that's why this is a pandemic, right?
Exactly, and that's why I feel as if it should be. I look, I'm just like I said, one voice, but this is something that we shouldn't play with, and I can tell my child, to go to school, wear the mask. I tell them wear the mask, but they're kids, they're kids.
And like, take it off even once or twice, so or touching it. It's really negating the effect of the mask. So, getting vaccinated is the best tool. It is, especially for kids. And the vaccine has been so effective in reducing the risk of children, even more so than adults.
Any final questions? Okay, if not, I just want to thank you all for attending one more time and for continuing to work with us as vaccine ambassadors. I also want to thank Dr. Kantola for being here today and sharing such great information with us. As we've said a couple of times, there will be some more information in terms of talking points for that handbook and flyers that we will get out to your lead ambassadors to give to you. So keep that in mind for the future. And lead ambassadors, again, please make sure that you have an attendance record of who was here tonight, just so we can get them paid for their time. But other than that, thank you all for coming, and I hope you have a great rest of your evening.
Thank you.